it's Debbie Seidel-Bickey, and I am the CEO of Dental Hygiene Solutions, powered by Dental Practice Solutions. And today I wanted to talk about a very important screening. And for decades as a dental professional, we have always done this screening. It's an oral cancer exam. And with the latest technology, it is so valuable for our patients to have this screening annually. But the question I always get is, how much should we charge the patient? And in today's blog, when you go to dentalpracticesolutions.com/blog, you could read about my tips for getting paid and having your patients be screened for this life-saving abnormality screening. One of the things that we talked about, I had a live event on Friday, and we talked about what words to use. So I wanted to just first say you have to kind of know your patient well. I've been talking about using the word abnormality screening so we don't freak those patients out who are going to say, no, I don't need this because I don't have cancer. So we talked about some of the patients who want to know that it's an oral cancer screening. So it's really up to you to understand your patient and know what words will be key in getting them to say yes for this life-saving screening. Now, I recommend, and a lot of our clients are currently charging about $20. There is a CDT code that many of our clients are getting paid, and in the blog I will have that highlighted for you. But they are billing for it. Here in Oregon, I've had an office in Southern Oregon receiving $70 annually from some insurances, and another office in downtown Portland was getting $50 annually reimbursed for their patients having this screening. One of our other offices in LA is currently talking to their patients about this valuable screening that's life-saving, and the patients are saying yes, and they're telling that they will bill their insurance, but if their insurance doesn't pay, it is a $20 cost. We have a hygienist that's doing 2 to 4 screenings a day. And I wanted to share with you what I'm using, which I absolutely love, is this. It's the Oral ID, and I am so lucky I have the gold one. But it's just, shining a light, and the fluorescence light actually changes the display of the dysplasia of the cells. So you're going to see a lot of white, chalky looking soft tissue in the mouth when it's healthy. And you'll see that it lights up a different color, like a bluish green or darker color than that white when there's an abnormality. And I love the Oral ID. They just have a lot of training for you once you actually lease the Oral ID if you're in the United States. We have clients using this all the way across the world, from Cyprus to Australia and all throughout the US. And I can tell you that in Cyprus, that doctor on a regular basis unfortunately does find abnormalities and carcinoma. So it's just life-saving. We can't be without it. So I just wanted to invite you to check over at our blog and read more about it. And I'll have a link if you'd like to know more about the Oral ID. I will see you next week. I'm talking about something, maybe another service in the hygiene department. I'm thinking about talking about the comprehensive perio evaluation. That's a code that we see most offices aren't utilizing, and when they are utilizing it, probably not billing it correctly. So I'll talk to you about that next week. Thanks for joining me. Bye for now.